You know, they say an apple a day keeps the doctor away, but what if the apple is actually making you ill? According to the FDA, 80% of all antibiotics used in the U.S. go into agriculture, and that means the very food we eat is treated with drugs. And health experts say that's creating resistant forms of bacteria that could be making us sicker. So how do we fight these bugs without forsaking nutrition altogether? Congresswoman Louise Slaughter has an idea. She's introducing a bill to ban the agricultural use of antibiotics, and she joins us now from Capitol Hill. Representative, great to have you here today.
Thank you, Mr. Roberts.
What prompted you to introduce this legislation?
I have a degree in microbiology and a master's in public health, and I knew that Staphylococcus aureus was a ubiquitous but fairly harmless bacterium. It has now mutated into MRSA, which can kill you in 24 hours. About 100,000 people every year die in American hospitals from infections that can no longer be controlled by the antibiotics that we have now. What we want to do in this bill is to phase out the use of 7 antibiotics that are extremely important to human beings and to their health. We want the sick animals, obviously we want them treated, but every day animals, poultry, pigs are given antibiotics in their feed. It's possible to buy 50 pounds of an antibiotic at a feed store. This has been a dreadful medical calamity, in my view, that is only growing worse. It's also a trade issue, Mr. Roberts. The European Union and the country of Denmark banned antibiotic use years ago. The European Union is looking at it. We have, from time to time, had import of some of our animals denied into other countries because of what we had fed them. This could get even worse. We're trying to make sure that we can stop it. It's not good for anybody.
Is the level, though, of antibiotics in the food really high enough of a quantity to pose a threat when we talk about our day-to-day human health? And then explain to us, Congresswoman, the food that we consume commonly, which are treated with these drugs. Which are they?
These are cattle, poultry, and pigs, the ones that we are concerned about here today. Absolutely, it is provable. Those bacteria have mutated. There is no question about that. We know that. It costs to the healthcare system in the United States, added cost, anywhere between $16 to $26 billion. That's money, obviously, that we can't use, but we're killing people with this. It would be like a mother sprinkling antibiotic on her child's cereal every morning in hopes the child would not get sick. But the antibiotics, I believe, are used because so many of our animals are kept in pretty much unspeakable conditions, overcrowded, filthy, unsanitary, and the antibiotic use daily, they believe, will prevent illness. But what it is causing is illness for human beings.
Representative Slaughter, how has, I guess, working on the bill that you're proposing or the legislation that you're proposing changed how you eat in your daily life?
Oh, I have a family, not much. I represent upstate New York. Upstate New York, agriculture is our biggest business. I'm not worried about my daily life. I'm really worried about my constituents and the future of the United States, both on health issue and the trade issue. Frankly, I would like to see this contamination that goes into the water supply. We plan to go even further when we're trying to get some clean drinking water in the United States. It is not doing our health any good, and certainly if it is costing $26 billion a year to treat, it's not so good for our economy either.
No, but I mean,
we simply have to persuade the agriculture community that, like Denmark actually saw improvement in the yields of animals than the United States has by cleaning up and not feeding them antibiotics. And I think Americans are not aware of what's in that food, and they don't want it. We also get it in animal runoff, gets into our water supply. Now we have just had a new study out that shows that the mutated bacteria can be carried by cockroaches and flies. So, you know, the best thing for us to do is to phase out, at least save 7 antibiotics, common ones, that we can use to treat human beings. That's what we want to do.
No, I was just curious about how it may have changed anything that you do with your daily life, because for a mom or a dad that's out there watching right now who's curious about the legislation that you're trying to pass forward, will be concerned about the food that they're giving to their kids tonight.
The mom and dad should join many groups, including the AMA, Union of Concerned Science, Pew Trust, and many other people, and trying to stop it. That would be the best thing for all parents in the United States to do.
All right, Congresswoman Slaughter, great to have you on today. Appreciate your time, and we'll see you again soon. Thank you.
Thank you very much.